Okay.
Okay.
Okay. Fine. Okay. You can share, sir, if you want. That's fine.
ഇപ്പൊ
No
ഷെയർ
problem.
ചെയ്യാൻ എനിക്ക് ഇപ്പൊ ഷെയർ ചെയ്യാൻ എനിക്ക്
ഷെയർ ചെയ്ത് വെച്ചിരിക്കുക.
You can see that I can see here.
ഇല്ലല്ലോ.
சார் அது ஷேர் ஸ்கிரீன் கொடுத்தா போறோம்ல சார், பிபிடியை ஷேர் ஸ்கிரீன் கொடுத்தா போறோம்.
ഇല്ലല്ലേ.
Yes sir. Yes, sir.
Can you see the slides now?
Yes sir. Yes sir.
Am I audible?
Yes sir. Audible.
Yes.
Okay.
Yes, please carry on.
Sir, it is
Thank you.
Okay.
I think Dr.
Okay.
Sukumaran is
Sorry
starting.
for the early disturbance. My beloved friend, Dr. Vijay Shekaran, with whom I worked for a number of years, and for the last 25 to 30 years, we are very close friends. We are working together in the respiratory chapter for so long. The beloved secretary, Dr. Vishwanath, beloved President Suresh Balan, Dr. Bala, and my dear friends. It gives me great pleasure and privilege to be here with you to participate in the CME program. And I should congratulate the Tamil Nadu ECHC group to start a CME program like this. In the next 30 minutes, I will be talking on the impact of air pollution on respiratory system. As you all know, according to WHO says that in more than 40% of childhood illness, some amount of environmental interaction is there. So it is very important that you must take a detailed environmental history in all children with any medical problem or surgical problem. Air pollution, global warming, and climate change are interrelated, having great impact on allergic disorders in children. Airway allergies are the earliest onset non-communicable environmental disease. Airway allergies, the common ones are asthma, allergic rhinitis, and comorbidities like sleep disorders are global epidemic where women and children are more sufferers. 70% of disease caused by environmental pollution are non-communicable disease, and 70% of the non-communicable disease are from air pollution. If you take the mortality from air pollution, the outdoor air pollution caused 3.7 million deaths, and indoor air pollution caused 4.3 million deaths. Fossil fuel alone can cause premature deaths in 79.16 lakh in Asia and 26.6 lakhs in India. And you know, the welfare loss is also done there. Adaptation to climate change is essential in primary prevention of allergic disorders and air pollution. Now, you can see asthma is the commonest global respiratory problem. It accounts for nearly 334 million people in the world. And you can see that if you check the changing disease pattern in India from 1990 to 2060, it is seen that communicable disease like pneumonia, TB, pertussis has come down from 61% to 33% because of the massive immunization program. But the non-communicable disease are increasing slowly in India from 30% to 55%. And if you find out the air pollution allergic disease, you can see the prevalence of allergic rhinitis and asthma. It is seen that in 1994, only 75% of the children with asthma had allergic rhinitis. In 1999, it is 81%, and 2004, 99.6% of children with asthma has got associated allergic rhinitis. Now, coming to the source of air pollution, the outdoor air pollutions are the most important sources are automobile exhaust. It affects the airways, especially nitrogen dioxide, sulfur dioxide, ozone, and particulate matter, photochemical oxidants, and toxic substances like carbon monoxide and lead, and carcinogenic like benzene, aldehyde. And power plant emission can also produce air pollution. Open burning of solid waste, construction-related activities, mining activities, pollen and fungi can produce air pollution. Coming to indoor air pollution can be due to aerobiologicals, and the commonest aerobiological is dust mite, cockroach, pollen grains, fungal, pests, and bacteria. Coming to the irritants that we see is tobacco smoke. In my PhD thesis on asthma and environment problem is smoking. you can see that in more than 75% of children, we have seen that the commonest trigger factor is tobacco smoking, and it is seen that the grandfather in the house will go on smoking by keeping their children on their laps, and if the mother tells the grandfather to stop smoking, he will not stop smoking, and it will create a family quarrel also. So most important factor is environmental tobacco smoking. The common air pollutants are particulate matter, ground level ozone, carbon monoxide, nitrogen dioxide, sulfur dioxide, and volatile organic compounds. Hey, what is the relation between air pollution and allergic disease? It is seen that those children who are genetically predisposed to allergic disease, if they are sensitized by smoking, environmental pollutants, loss or absence of particular factors, and viral infection, and they are predisposed to allergy. And so genetically predisposed children who are exposed to one of the trigger factors, they can develop allergic disease. Why children are more susceptible to environmental pollution? Due to multiple factors. Children are exposed transplacentally through the breast milk, and through the breast milk, the children has got an exploratory behavior which leads to exposure. The children always take their hands to mouth, and they take objects to the mouth, and there's a habit of non-nutritional ingestion of soil dirt, about 400 milligram per day, whereas in adult take only 50 milligram. And children are lower to the ground. The breathing zone is 25 centimeter in adults, where in children it is 100 centimeter. Children have high surface area to volume rose, and the lungs are not well formed at birth, and full maturity of the lung occurs by 6 years of life. The bronchial tree is still developing, and the number of alveoli increases from 24 million at birth to 257 million at 4 years. The large surface area per kilogram body weight is also another contributory factors. Children breathe 50% more air per kilogram body weight, and children spend most of the time outdoor, and immune system and developing organs are immature, so they are prone to environmental pollution. And children inhale more pollutants per kilogram of body weight than do adults. And because the airways are narrowed, irritation can result in proportionally greater airway obstruction. Then coming to the effects of pollutants on the lung, antenatal smoking. If the mother smokes, it can produce constriction of the uteroplacenta circulation, increase release of catecholamines, decrease fetal breathing movements, and it can produce altered control of breathing. And post-natal exposure of environmental tobacco smoke can lower the lung function. And exposure to house dust mite is a commonest aero allergens, and irritants like ozone can produce altered airway growth, decreased breathing, thickening of the walls of the airways, and it is found that it can produce increased mortality from pneumonia, increased morbidity from asthma, can produce chronic cough, allergic rhinitis, sinusitis, otitis media, and sudden infant death syndrome. These are the main clinical effects of smoke. It can produce recurrent respiratory infection, prenatal complications like low birth weight, medullary effusion, asthma, fire-related injuries, sudden infant death syndrome, and cancer. Now, coming to second-hand tobacco smoke. Tobacco smoke is the commonest trigger factor for or allergic disorders. Children whose mothers smoke, we have seen that there are 70% more respiratory problems. Pneumonia and hospitalization in year 1 is 38% higher. Infant mortality is 80% higher, and 20% of all infant deaths could be avoided if all stopped by 16th week of gestation. And there is a 5 times higher risk of sudden infant death syndrome due to secondary tobacco smoke. This is what is called a life cycle effects of smoking. Smoking on health issues. Smoking can affect at all ages. Exposure in utero, it can lead to low birth weight and stillbirth. And infancy, tobacco smoke can produce sudden infant death syndrome, respiratory syncytial virus infections, bronchiolitis, meningitis. In childhood, there is an increased incidence of asthma, otitis media, fire-related injuries. Adolescents infants start smoking, and nicotine addiction can occur. And adulthood, there's a high chance of cancer, cardiovascular disease, and COPD. So it is very important that we must stop environmental tobacco smoke by legalization. And I will just talk about, Dr. Vijay Shekhar was talking about the ISAC study. The largest study group which has conducted the prevention of asthma and air pollution is by the ISAC study. I was a part of this ISAC study. You can see Heinz Usher, who is the chief of ISAC study. And ISAC study, phase 1 and phase 3 were conducted. It is a multi-center cross-section studies in children in randomly selected schools. And we have studied this prevalence of asthma and trigger factors in 2 age group, 13 to 40 years age group and 6 to 7 years age group. And in each age group, we have studied more than 3,000 children. And the standardized, validated, simple written questionnaire was given to these children. And they filled up the forms and returned the forms. And this is prevalence of asthma symptoms in 2001, 2003 in 233 centers in 97 countries. You can see the red star, which shows prevalence of more than 20%. And one of the red star is seen in Kottayam district in Kerala, where I was the principal investigator. This study has found that asthma has occurred everywhere in the world. There's more than thought, and there was a large variation in the prevalence of asthma. The asthma overall incidence was increasing. The increases were more common in low middle income countries, and asthma was more severe in low middle income countries, and association with atopy was big in low middle income countries. And after 2015, this ISAC study was replaced by another international study. This is called a GAN study. GAN stands for Global Asthma Network. And this study was conducted in more than 26 countries. And in India, there were 9 centers. In Kottayam, I was a principal investigator. From Mysore, Dr. Mahesh's study from Pune, Calcutta, Lucknow, Jaipur, New Delhi, and Chandigarh. From New Delhi, Dr. Kabra was there. From Chandigarh, Minu Singh was there. And from Jaipur, Dr. Virendra Singh. He was the principal investigator throughout India. And this GAN study has shown that the prevalence of asthma was decreasing in low middle income countries, and it remains static in upper income countries. Now, these are some of our data. Our correspondent, Dr. Parmesh, Dr. Vijay Shekhar might have seen these slides before, and we have shown that there's a correlation between increasing prevalence of asthma in relation to increase in industries. We can see that from 1979 to 1919, there's an increase in the number of industries in Bangalore, and we have seen that the prevalence of asthma has increased to 29.5%. Again, Dr. Parmesh, this study has shown the relation between prevalence of asthma and population. It has shown that as population has increased from 79 to 1999, the prevalence of asthma has increased to 29%. Then coming to the prevalence of asthma and automobiles, it is seen that as the number of automobiles increased, the prevalence of asthma increased. And Dr. Parmesh has again studied the prevalence of asthma in urban children and rural children. And urban children, the prevalence was 16.6%, and rural children, it was 5.7%. And the effects of prenatal and perinatal effects of air pollution, we can produce early fetal loss, preterm delivery, and low birth weight. Then air pollution and recurrent respiratory infection, it is seen by studies from Stansfield has shown an association between indoor air pollution and recurrent effects of acute lower respiratory infection and increased ARI in houses of children who use biomass. And again, these are some of the summary results of a GAN study. I already said the prevalence of current visas decreased in low income countries, increased in the lower middle income countries, and was stable in upper middle income and higher income countries. Now, how can you avoid air pollution? The quality education of all stakeholders are very important. And most important things are you must reduce the pollutants at source and try to eliminate emission and protect our children. To reduce the pollutants, guidelines, regulate automobiles, and there should be no energy source should be there. And you must reduce the fossil fuel, because fossil fuel is a very important source of air pollution, climate change, and global warming. And as the national president of IAP and a member of, active member of Indian Academy of Pediatrics, what IAP has done. IAP, along with International Pediatric Association and WHO, he has conducted a workshop in Delhi for environmental health children and adolescents. And you can see this workshop was organized by our past national president. And then you can see Dr. Paramesh, Dr. Sachidananda Kamath, R.K. Agarwal, myself, and you can see Dr. Ruth, who was the international chairperson of the International Pediatric Association, who was involved in environmental health, and also you can see Dr. Sadi Bave. And this workshop has trained a lot of Indian pediatricians on environmental health and prevention of environmental problems in children and adolescents. And there was an IAP task force on prevention of tobacco use in children and adolescents. And I was the global tobacco program, and I was a chairperson, and the international coordinator was Dr. Sadi Bave, and it was an IAP action plan in 21, and national coordinator was Dr. Sachidananda Kamath. To prevent this tobacco smoke, the commonest irritants of the respiratory tract, IAP has prepared a CD on tobacco prevention as a school program, and it was sent to all IAP branches, and we have conducted training programs for students and teachers through PTA. So what are the carry-home messages there? Air pollution, global warming are interrelated and having great impact on allergic diseases. Allergic airway diseases are the earliest onset communicable disease, and airway disease, allergies like asthma, allergic rhinitis, and comorbidities like obstructive sleep apnea syndrome, chronic cough. The main trigger factors are air pollution. You must look for all the indoor pollution and outdoor air pollutants, and look for aeroallergens. And also you prevent the exposure to aeroallergens to have a healthy life for our children. To conclude, what I want to say is that healthy lung should be there for healthy life, and control air pollution before it controls your breath. So most important, you have a healthy lung and healthy life. You control air pollution. And thank you very much for your patience listening. Again, thank my beloved friend Vijay Shekaran for getting another opportunity to be with him. And also I thank the Secretary, Dr. Vishwanathan, then President, Dr. Suresh Baran, and all my beloved friends of Tamil Nadu IAP for listening and for inviting me and giving this opportunity. Thank you very much. Jai IAP. Jai Hind.
Thank you, sir. Thank you for your excellent talk on this air pollution, because we know Dr. Sukumaran, how he is doing his work from the days of Dr. Paramesh. And I think they are the one, Dr. Paramesh, Dr. Sukumar and Dr. Nagaraj. These people are working together, both very closely, environment and allergies. And they've done excellent work. And I think many people may ask me something, how allergen is correlated with the environment. Allergy is correlated with the this environmental crisis. I think Dr. Sukumaran may tell something. I want to add something. See, sometimes these vehicular emissions produce a lot of carbon dioxide, and carbon dioxide is one of the greenhouse gases. It forms a blanket around our planet, and when it increases because of the man-made activities, this heat increases that cause so much climate crisis, including that glaciers are melting and sea level rising, change in the flow of wind, and also rains and all. And that is the way it goes on. That is the reason why we want to reduce our comforts, like even reducing 1 degree of your AC helps a lot. I think I want to ask Dr. Sukumaran how the plastics are related with the hill health, sir. Sometime I want to. I saw many birds are taking the plastic things. And when they cut open their stomach, we can see a lot of plastics there in the stomach of plant, dough or something like that and all.
See them. Thank you, Dr. Vijay Shekaran. And this year, for the World Environmental Day, our main action plan was prevention of plastic pollution. And we were mainly saying about the recycling of plastic, reuse of plastic, and reduce the use of plastic. Plastic contains a lot of chemicals which are carcinogenic. It can produce carcinogenic, and also there are a lot of endocrine disruptors are there in plastic. And also it is seen that even the microplastic is more harmful. So it is better to prevent. So mainly it can produce cancer, and also it can produce endocrine disruption and endocrine problems in children and adolescents.
Thank you, sir. Thank you, sir.
Sir, MSc, sir, one question, sir, to Sukumara, sir.
Yeah.
Sir, it was an excellent presentation, sir, and you highlighted the role of air pollution in asthma and lung diseases. But my question is, we all know there is an increase in the air pollutants, so no doubt about it. And more so, it is a diagnosis of exclusion only. Is there any newer modality to say that this child is suffering because of air pollution, this asthma is there? Is there any diagnostic tool or any other modality to confirm it and say that this child is having an exacerbation of asthma because of air pollution?
See, there are some studies are there, and they have taken the ball and have taken the BAL, bronchoalveolar lavage, and have estimated the amount of carbon in the macrophages in the lung, and there is a high association between increased amount of carbon particles in the macrophages and allergic disease. But it is only a coincidence, and we cannot confirm that.
I just add only one point, sir. If normally your lungs looks like red, okay, when you get more and more that air pollution, including smoking, it turns into a brown and black.
Yes.
Black. Everything goes there. That is the reason why I think.
Is there any radiological evidence, something like that?
No radiology.
Okay.
Cytology.
See, our friend Dr. Kalpanamar from Davangere, he has done a study on carbon particles on macrophages in children who are exposed to air pollutants.
Okay, sir.
Thank you.
Think probably time
We'll come back.
consuming. I request probably that from other side, you may ask a lot of questions. Sir is willing to answer, but we are slightly shooting our time. And I think I thank on behalf of the organization, Dr. Sukumaran. I think he is doing always excellent work. When they say Sukumaran, I immediately said X. I didn't say anything. The name itself, whether you ask, I know sir is doing so much excellent work and all. With this view, I wind up our program, and we want to give a way to our next program. Dr. Sivaprakasam is already waiting, and I am also happy to hear the lead poisoning and all. Thank you, sir. Thank you, Viswanathan, for the opportunity. And the entire people, the youngsters are doing excellent work. The Tamil Nadu team is doing excellent work. I want to tell every name, but because of the time, I am not telling. Thank you very much.
Thank you, sir. Thank you, sir. Thank you, sir.
Thank you. So, Professor Sukumaran, thank you for excellent talk, and thank you for giving your time. And Professor Vijay Shekaran, you look very young even now. You are also among the youngsters. And Dr. Siva, I will go to the next talk, and I will just introduce briefly our chairperson, Dr. Sivaprakasam, sir. 1 second. Dr.
Sir, good evening to all, sir. It's a pleasurable occasion for me to introduce our close friend, Ramesh Bajania, none other than our Vice President of West Zone 2025. So I'm very much pleased about the total biodata which I read. So he started his career in 2010 as the organizing secretary for the Gujarat Pedicab. In 2016, he becomes the organizing chairperson of the Environment